Welcome to Concussion Fix Minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go.
Right. Hey, my question is probably for you, Cameron. But I guess first a little bit of context. So I'm 34 years old. I work as a data scientist. My accident happened May 2023. I put my bike wheel in a streetcar rail and flipped forward face first into a car. Broke my nose and split my lip. And I guess my neck absorbed the shock. Luckily, no structural damage on MRI, so that's nice. However, I do have the following symptoms: pressure headaches, trouble sleeping, especially without aids. I have this tightness in my throat, tightness in my neck. I have concentration issues, and I get this sudden episodes of retching / gagging when I walk or run. It's quite interesting that because I do a fair bit of snowboarding as well, and it doesn't present itself there. So nor does it do that when I'm cycling. And I've also tried getting my pulse up without like walking or running. So I've sort of ruled out the pulse thing already. And interestingly, when I push on my SEM muscle, this instantly provokes this sort of retching. And this is a problem that's presented itself after I had COVID, which I find interesting. It just sort of came out of nowhere in November.
The retching specifically? Are you talking about the retching?
Yes, the retching in particular, yes.
Okay.
That's the new one. All the other ones are sort of
that came on after you had COVID, but you had the concussion and neck injury in 2023.
Correct. So and I guess my primary sort of stressor in like the general symptoms is mainly screen. So it's mainly my job keeping me back. Like when I'm on holiday, I live a pretty normal life. So my question is this. So given the above, what sort of treatment options should I like look at for like sorting out this retching issue? Yeah.
Cam, do you want to take it?
Well, I mean, what do you think's going on in terms of the retching, Paul? Do you have any thoughts on that?
Well, yeah, I mean, like right away, just from what mentioned, I would say the fact that he can reproduce it by pushing on his SEM, that's like a pretty big giveaway that there's definitely some neck dysfunction.
Mm-hmm. But why would that cause retching? I'm just trying to think like anatomically or.
Well, like, okay, so gagging, retching, this is a very strong, the vagus nerve is very strongly involved in those two functions. So could there be some sort of input? Again, I don't see a direct kind of anatomical, physiological connection between the SCM but I mean, other than it's like pretty close to where the vagus nerve innervates, but vagus nerve is mainly internal, not so much external.
Right.
So he might just have this unique, I mean, I don't know, I guess unique anatomical connection between the two. So I would right away, just from like low hanging fruit wise, I would start with the vagus nerve rehab component, see if that makes any difference. Have you had any sort of manual care to that area that you've just told us that stimulates that retching?
No, I haven't. I have had visual treatment done, and because I did have like poor convergence with my eyes, and they were skipping around a little bit. But that's sort of mainly finished up, or it's finished up now. So my vision is quite normal now. But I haven't had any manual therapy. No.
Is it both sides?
Yeah, it's both sides. It's especially when I massage both sides, just underneath, behind the ears.
Behind the ears, eh?
Yeah,
So
yeah.
up this
So
way over here.
And
correct. Yeah.
yeah, I'm kind of having a thought too about, Dr. Cam, you talk about, self-massage and self-treatment can, generate different types of symptoms, right? Is it possible he's having like a sympathetic response to sort of poking around?
Yeah, I mean, that's my only theory. That's why I was asking Paul about if he thought of anything around the retching, because the only thing I could think of is some sort of sympathetic response or something, because the neck is related to kind of this autonomic dysregulation as well. Like some people with neck instability will also have autonomic dysregulation as a result of that neck issue. Immediately I started thinking something with like recurrent laryngeal nerve, but again, that's more deep structure and it's not necessarily going to be innervated directly by the SCM, but it could be something where pushing on that causes that kind of, dysregulation and that sympathetic response. But then if he can exercise normally and get his heart rate up, it kind of leads me away from
The autonomic.
but maybe he's okay with exercise, but maybe it's a different pathway that I'm not aware of. Because people will get flare-ups with just manual therapy in general, right? And that can be an autonomic or sympathetic response. But yeah, I agree with Paul's suggestion and the fact that if you can push on your SCM and recreate that, getting some work to try and loosen that off may alleviate that symptom, right? It's going to be, when you get it done, it's probably going to bring it on quite a bit.
Mm-hmm.
But as it works through and as things loosen up, you may be able to do other things without that response happening. So it's one of these kind of trial and error things. You just got to give it a shot and see if that helps. The fact that you can get your heart rate up with cycling or things where you're not bouncing up and down also kind of potentially points to something like that, where maybe there's neck involvement when you are bouncing up and down or doing like running, that tends to bring that on. And neck dysfunction is also related to some of those visual symptoms that you were experiencing. And so, especially if you are still having some visual symptoms, you don't feel quite right visually, but the optometrist or whoever has told you that your eyes are normal, but you still don't feel quite right, there's probably some neck component to it that's driving that continued feeling. So yeah, I would start with the manual therapy. What else have you done in the program? Like how far in are you?
Let's see. I'm working my way through the mindfulness stuff now.
Okay.
And
Yeah.
like
So there's
meditation stuff. Yeah.
Yeah. So there's once you kind of get to, once you kind of build that foundation, that'll likely help as well, because that'll help to bring down that sympathetic response, and it may assist with that sensation as well. But if I were you, I would try to get some good manual work. The problem is a lot of practitioners don't work on the SCM. Like you come in and they just work on the back of your neck, and they're really shy away because there's blood vessels in there. You got arteries and, your jugular vein, and you got your brachial plexus, which is all the nerves to your arm. And so practitioners get really uncomfortable about treating that area. Whereas I just dig in and go for it. I treat that on everybody. So you got to find someone who's willing to get in on the SCM, and work the SCM and the deep neck flexors as well, because those are closer to that one nerve I was talking about, which is the vagus part of the branch of the vagus nerve, but it's a recurrent laryngeal nerve that actually kind of innervates the vocal cords in the throat. And so getting some work done on the deep neck flexors may free something up that helps with that response as well. So it's deep neck flexors, SCM. See if you can get somebody to kind of work on those with some manual care as you do all the other steps as well, to try and bring down that sympathetic response and see if that helps. Again, we're not really sure why it's happening. We're kind of just grasping here. I don't think we have.
Yeah. I'm just looking for the general direction. Luckily I have there's a clinic close by actually, which does they're complete concussion care certified.
Okay, so where are you located?
I'm in Oslo.
Oh, perfect.
Norway.
Yeah. Okay. Yeah, we have some really good. Christian Hageson is. There's a few clinics in Oslo. Probably the most experience would be Christian.
All right. Do you know which clinic he
I'm gonna look.
practices at?
I'm gonna look right now for you.
Thank you.
While you're looking that up, Cam, one of the thoughts I was wondering we didn't really understand yet was when COVID occurred, how long ago was that? And when did the retching kind of begin? Did we cover that yet?
I think he said it after COVID this past fall.
Yeah, it was November, and the retching started a week after.
Okay. And then when did you start the program with us?
It was actually this was what inspired me to actually take the program.
Hey.
Yeah.
Yeah. So that started, then you began the program.
Yeah. However, having said that, I've always sort of had this. I always thought it was like a pulse issue before. So I've been doing loads of running, and I've always felt a little queasy after that. But then I did some cycling, just in a gym, like one of those still standing bikes, and it very quickly occurred to me that I could push 190 without that being an issue. I didn't get any symptoms from doing that. So yeah.
This is all following your concussion?
Yes.
Yeah, to me, the fact that you can exercise to that degree, it sounds like an autonomic symptom, but yet you're able to exercise fully, which kind of goes against that idea. So, but it may just be autonomic dysregulation because of the neck alone. So exercise isn't bothering you, but once, when you're doing running or something, or maybe your neck tenses up, maybe that's putting some pressure on something that's causing that. So I wouldn't just do the foundational stuff, continue with the program, but I sent you 2 links here in the chat. You can see here, one of them is Nemus Storo. That's the one where Christian is. And then there's also another clinic called Apex. And they're also extremely experienced. They're very good with vestibular type stuff. They're mostly physios. And they have an osteo and a chiro as well. So that would be a good option too. So you might just try one of them and see if they're able to get to the root, and if not, you may try another one, right? Because when it comes to manual stuff, people have different hands, different styles, different, so it's a lot of trial and error. So, I would give it at least 6 sessions with one of them, and then if you're still not getting there, maybe try with the other one for a bit and see if that helps. That's the only thought I have, really.
I would definitely also incorporate the vagus nerve.
Yes, yeah, that too,
right?
That too.
So
yeah.
Because I think, Cam, you're right that it's most likely some sort of sympathetic response. If it's not fully in a purely an anatomical response, that's not really a common connection that you get such a strong sympathetic, very specific. But the clue is that you can recreate it after pressing. So there definitely is some sort of anatomical stimulation there. And then also the fact that it came on after COVID. And so that tells us that there's an inflammatory component to it. Any sort of symptom that's worse after eating a particular food protein or after you're exposed to some sort of viral infection is a pretty strong indicator that there is some sort of neurological priming. And if you haven't got to that section yet in the course, you will. I definitely talk about it in my section, so you're almost there. Linda talks about the importance of the vagus nerve. I definitely talk about the exercise side of things with the vagus nerve. So that tells us that there could be sometimes the vagus nerve is what's affected by the COVID virus, and that's why there's such variation between symptoms in this syndrome called long COVID syndrome. So again, just to kind of piece all this stuff together, I think all the components we are going to talking about in the concussion fix are applicable, and you may need to really double down on the manual and the vagus, and then also the anti-inflammatory stuff. So you're almost there, so keep going.
Yeah, thank you guys. That was a very thorough answer. Cheers.
You're welcome. Good luck. Keep us posted.
Yeah, we want to know.
Thanks for listening to this Concussion Fix Minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.